Good morning, everyone, and welcome to Coffee with the Commission, a time where the WMC discusses topical issues that affect you. Today, we will be talking about Communication and Resolution Program certification and its value to improve patient safety after adverse events. Today, I'm joined by Felicidad Smith, who is the CRP Manager at the Foundation for Healthcare Quality. She's going to provide an overview of Communication and Resolution Programs, also known as CRPs, and provide a framework for organizations interested in communication resolution programs to activate just culture principles. So before I turn the webinar over, I would like to take care of a few housekeeping items. We encourage you to ask questions throughout the presentation, so look for the question button or use the chat box within the Teams framework, and we will do our best to address your questions at the end of the presentation. We are recording this webinar, and the on-demand version will be available on our website within the next few days. So please feel free to share these resources with your friends and colleagues. Now, with all of that out of the way, I will turn it over to Ms. Smith.
Hi, everyone, and thank you so much for having me. So as Jimmy said, my name is Felicidad, and I am the Communication and Resolution Program Manager with the Foundation for Healthcare Quality. And I'm really thrilled to be here today to share with you all the really important work that's happening in patient safety and quality improvement, and what's happening through CRP, aka Communication and Resolution Programs, and how the Foundation for Healthcare Quality supports this work. So just to share a little bit about me, I joined the foundation in August of last year, just shortly after graduating from the University of Washington with my Master of Public Health with a concentration in health systems and policy. So when I joined this position, I was very entirely new to this field of patient safety and quality improvement in CRP. But I will say it's been such an interesting and informative learning experience so far. Getting to work with so many passionate individuals has been such a rewarding experience. And so again, I'm very thrilled to be able to share with you some of the work that we've been doing and that we hope to continue to do with patient safety here in Washington State. And also just to quickly share a little bit about the Foundation's history with CRP. So as Jimmy said, we have the CRP certification program, which I will be describing in a little bit more detail coming up. But that first started back in 2016, still housed within the Foundation for Healthcare Quality, but was under the name Health Pact. And that also involves a lot of collaboration with researchers from the University of Washington. So CRP certification under Health Pack ran from 2016 to about 2020. It was funded by ARC, the Agency for Healthcare Research and Quality. And so once that funding expired in 2020, along with all of the other things that happened in 2020, CRP certification ended up being paused for a couple of years until August of last year when I joined. So yeah, it's been such a rewarding experience so far, and I'm really thrilled to be able to share with you what we're doing. So just to start off by going into what exactly CRP is. So essentially, it's a framework of essential commitments, elements, and steps to help guide an organization's response to patients who have been harmed by their healthcare, while also addressing the quality and safety gaps that are responsible for that adverse event. And in terms of CRP, patient harm can be of various severities. So it can range from temporary, non-permanent harm or emotional distress to severe permanent patient harm or even death. So with CRP, it has a variety of commitments. The first commitment is, of course, caring for patients through transparency with empathy by practicing ongoing communication, as well as ongoing support. Another commitment is to investigate what happened, to learn from what happened, and as well as implement practices to make sure, implement prevention practices to make sure that the harm doesn't happen again. It is also committed to supporting clinicians through peer support. And a final commitment is through training healthcare leadership in CRP principles to ensure that all staff are aware of the institutional commitment to CRP and to transparency and those core CRP principles. So at CRP, it's a just culture approach. So we're hoping to shift the culture of those traditional practices of denial and defensiveness following an adverse event towards a culture that embraces empathy and embraces transparency and honesty to make sure that patients are really feeling supported after an adverse event and not abandoned by their healthcare. So to really show you what the CRP process looks like, I'm going to show you one slide, if you give me 1 second. Okay, hopefully everyone can see my screen. So this CRP process map was created by the Ariadne Lab, which I believe is housed in Harvard, the Institute of Healthcare Improvement, as well as researchers from the University of Washington. And this was created for the PACT Collaborative. PACT stands for Pathway to Accountability, Compassion, and Transparency. So with the PAC Collaborative, they are a nationwide organization who supports hospitals all across the country who are interested in starting their own CRPs. So with PACT, it's a year-long process, and they really support organizations from the ground up in implementing their CRPs. So I just thought that this process map was just so beautifully created and like very simplistic in really showing and highlighting what CRP can look like. So at the top, it lists the ideal days, the ideal time span in which CRP activities would take place. And then on the left-hand side, listed on the side, are the core CRP activities, which includes event management, event review, clinician engagement, patient and family engagement, and then resolution and reconciliation. And then all of the items in the middle are essentially the core activities that take place during CRP to ensure that the core principles of CRP are met. So for example, starting, say, a potential harm event happens and it is eligible for CRP, then the first step would be to enter the event into management software. And then within the first 3 days, identify who the CRP lead will be, gather information about the event, offer peer support to the clinician or licensees involved, and then have an initial conversation and initial communication with the patient and their family to make sure that their initial needs, their initial healthcare needs are being met following the event. And then also making sure that the patient's bills in regards to the CRP event are being held as well. In the middle, this is expected to take maybe 1 to 6 weeks, but that includes coordinating ongoing review to identify action items and improvements and really get to a better understanding of what caused the event and what can be implemented to ensure that the event doesn't happen again. This also can include interviewing clinicians and interviewing the patient and family, as well as initiating the claim process for event review, as well as preventability assessment. And then another aspect of this section of CRP is continued follow-up with the clinician and the patient family to ensure that all parties are feeling supported. And then the final section on the far right, which is expected to take approximately 6 weeks to maybe 5 months or even more. That could include really just finalizing the CRP process. Once all of the action items and the root cause of the event have been identified, it's implementing a structure in place to ensure that the event doesn't happen again. That could involve systematic change or even more training for the licensee if that's the case. This also includes closing the feedback loop or closing the communication loop with the clinician and patient and family involved, and then collecting their experience, gathering feedback from them on their experience during CRP, and then also proactively offering some sort of compensation, whether it's financial or non-financial, to the patient and family involved, if that would be appropriate for the situation. So yeah, this map is essentially what the foundation also uses to help support folks who are interested in going through any of our services. We help organizations who are going through this process and provide any additional feedback and support in navigating the complexity that is CRP, which I will be getting into momentarily. Let me stop sharing. All right, so again, in a nutshell, that kind of is giving you a little taste of what CRP can look like. There are a lot of benefits that goes along with participating in CRP, and that can include, patients deserve to know what happened to them if they're harmed by their healthcare. And so through CRP, it helps provide tools and resources that the organization or the provider can use to really navigate those difficult conversations that will be taking place, as well as providing tools on what it could look like, what patient resolution and reconciliation could look like, as well as what proactive offers could look like. And then also there have been numerous studies that has shown that CRP can result, like using the CRP process can result in fewer lawsuits and lower liability costs over the long term. Because again, other studies have shown that after a patient has been harmed by their healthcare, what they're really looking for is an apology and an explanation of what happened, because it can make the process so much more difficult if patients are abandoned or left feeling in the dark after an adverse event happens, and they maybe feel like they're forced into a position where they have to go through a lengthy litigation process just to understand what happened to them. So with CRP, it really opens the door to allow that explanation to happen, to allow that expression of empathy and regret or even apology to happen. And that could actually do wonders to reconciliation after an adverse event. And as well as for CRP eligibility. So again, CRP is a just culture approach. So really for the events to be eligible for CRP, it's really events where a medical error happens with a provider or licensee who is well-intentioned. So if there was evidence that suggested that maybe during the event, the provider could provide like significant risk of harm to patients through gross incompetence or recklessness, or if they were impaired in any sort of way or intentionally practice misconduct, that sort of stuff. Those sorts of situations would not be eligible for CRP. So yeah, again, that's like CRP. That's what CRP is in a nutshell. And I also wanted to share that there's a lot of really exciting action happening with CRP on the national level. So in September of last year, September 2023, a PCAST report on patient safety was published and was sent to the White House, where one of the recommendations was for the Center for Medicare and Medicaid Services to require, within 5 years of the report's approval, for hospitals to adopt CRP and demonstrate efforts of patient safety and transparent communication following an adverse event as a condition for CMS participation. So while that hasn't been approved yet, it has not been approved yet, it shows that CRP really is gaining that national recognition and is something that I believe we're moving towards as a system as a whole. So To support this work, to support this important CRP work, the foundation has 2 CRP support services with the aim of really helping organizations in navigating the CRP response. So getting into it, our 2 support services include CRP screening and then CRP certification, as mentioned before. But for both of these services, it really, the core is our CRP review panel. So the folks who compose this review panel include patients, patient advocates, physicians, surgeons, risk managers, attorneys, a variety of healthcare stakeholders who are volunteers. And these folks are just really passionate about patient safety and CRP work. So what they do is when we receive when someone submits an adverse event to us, either for CRP screening or for CRP certification, they will review the application, they'll review all of the supporting documents, and then we meet approximately once a month, depending on the amount of cases that we receive. But in that meeting, it's really about emphasizing the learning that is happening in regards to like CRP and patient safety. So they'll review the case, they'll go through it and provide any feedback for the applicant, which they can apply to their current CRP response or for CRP certification. So yeah, essentially this group is just, they're really well versed in patient safety and CRP, and it could be beneficial to have, a third party of neutral eyes on an event because in some cases, I know there are other organizations who do sort of adverse event discussions and that kind of stuff that really only like happens among like certain groups. Like say maybe it's only a group of risk managers who are talking about these cases. But what makes us stand out a little bit is how we can bring in the different perspectives from all of these different healthcare stakeholders so we can really get to like a more collaborative sense of how we can improve patient safety. So again, they're like a very non-judgmental group, and their goal really is to provide support in applying all of the CRP principles in your CRP or adverse event response, as well as widely sharing the lessons learned from every adverse event that's submitted to us. And for both of our CRP services, they are CQIP protected. And then, as I mentioned in the beginning, when CRP certification was first going on from 2016 through 2020. What we've heard from former participants of CRP certification is that one of the most valuable aspects of going through that process really is the feedback that they're given from the review panel. Because again, like having that feedback after an adverse event isn't always guaranteed. After an adverse event, maybe a provider never really hears about it again, or even if a risk manager submits and root cause analysis to DOH, maybe it could take a while to hear back. So with our group, with the CRP review panel, we're really here to support again, to really like get to and talk through what's happening with CRP and the adverse event to make sure everyone feels supported. I'll be getting, I see your question, Sandy. I'll be getting into what it means to be certified in just a second once I start describing what CRP certification is. But first, I'm going to talk about our first program, which is CRP screening. Okay, so again, we offer 2 services. This first one I'm going to talk about now is CRP screening. So with that, essentially, it provides support to organizations and providers who are navigating a CRP response to an adverse event in real time. So as I showed you before in the CRP process map, it could take weeks to months to fully complete a CRP process. And during that time, there could probably be so many questions that come up barriers that arise, challenges that you're having trouble working through, or where it may be beneficial to have the review panel or a neutral set of eyes to provide that support. So with CRP screening, where the review panel would be available to help you through the CRP response in real time. So they're providing support, they're providing feedback before your CRP response has been completed. So again, like an event or an adverse event could again be submitted at any point during the CRP process. So to actually apply for CRP screening, we do have a form for it. It can be found on our website, or you can follow up with me and talk more through it. But essentially what it looks like is just a handful of questions where you would identify where you currently are in the CRP process, detail the event and what happened, detail how you have currently applied CRP to your event, and then also just have space to ask the questions that you would like help in, talk about what challenges you're experiencing, that kind of stuff. So I would take that form or that application, de-identify it, because for both CRP screening and CRP certification, both of these services are anonymous by default. However, folks are more than welcome to attend the CRP meeting and actually talk to our review panel, like face-to-face virtually, if that's something that you would like to do. That's absolutely on the table. So the review panel would then take the form and go through the case, and they would have time to review it before the meeting. And then at the meeting, they would all come together and talk about what they're thinking, talk about the feedback that they would like to provide to the applicant, the organization, or provider. And then all of the feedback that they provide and all the advice and guidance that they provide will be summarized in a report that is returned to the applicant at the end. So if the applicant decides to attend the meeting or not, everyone will receive a summary of the feedback at the end too. So essentially that is CRP screening in a nutshell. Again, to really highlight it, it provides real-time support. So if you're having trouble, say like or having trouble approaching a conversation and would like advice on like how to provide guidance to a patient or family in some sort of interaction that happens later down the line in the CRP process, the review panel would be there to help if that's needed. And also for CRP screening, we also want to make room for events that may have happened in the past, but maybe that event didn't have a CRP like process that was used in response to it. So if you would like to talk through a past event and talk about how CRP could have been better applied or how CRP could have been applied in that past event, the CRP review panel would be able to talk through that as well in order to provide like future guidance into how CRP could be better incorporated in future practice. So essentially, with CRP screening, you can really think about it as like a CRP consulting service that could, value organizations up to thousands of dollars, but we are offering all of this support and advice for free. So that is CRP screening. And now for CRP certification. Again, this is our original CRP service that we are still continuing to do. So with CRP certification, this is really what the review panel will be looking for, like your I's are dotted and your T's are crossed, and they'll be going through the CRP certification application in very fine detail to make sure that all of the elements of CRP, like I showed in the process map, were present in the application, present in the CRP response. And so if the CRP review panel determines that yes, following the adverse event, all CRP principles are met, all of the key elements were there, they would be able to give their stamp of approval that that event is CRP certified. And what really makes CRP certification different from CRP screening is that with certification, we are very lucky and grateful to be able to have a memorandum of understanding with the commission. So with this partnership, I guess, any like certified CRP reports that would be granted to the applicant if it is certified by the review panel at the end, all of the like feedback from the review panel would be summarized into a report, just like with screening. But with CRP certification, you would receive a determination of either certified, not certified, or certified with contingency. So certified reports, if the commission essentially is investigating a adverse event as well, and the provider organization indicates that they're going through the CRP certification process, and for example, say everything went well and they applied all of the CRP principles to the review panel standards, then and they would receive a CRP certification report in the end, and then that report, the certified CRP report, could be submitted to the commission, which would be incorporated into their own investigation, essentially as further evidence that patient safety needs were met, and that patient safety needs were addressed, and that learning has occurred after the event. So really, CRP certification is a seal of approval from the review panel that the organization has taken the effective measures of incorporating patient safety, and they took patient safety seriously. So I know that was a lot, but essentially that is that's CRP. That's what the foundation is doing with CRP. If you have any questions about the CRP review panel or CRP screening or CRP certification, I'm happy to take them.
All right, thank you. I hope everyone will join me in a virtual round of applause. Thank you so much for giving this very important information. Members of the commission, you can turn on your cameras if you have questions for Ms. Smith. Otherwise, you can raise your hand. Dr. Domino, please feel free to unmute yourself and ask away.
Hi, I'm Karen Domino. I'm a professor at UW, and I know a fair amount about this. We use it obviously here and nationally at a number of places. I'm just curious, though, there are a couple things that I was wanted information about. Thank you for lowering my hand, by the way. One is that, there's been this hiatus. How many recent cases have you actually looked at in the last? I think you were hired, if I recall, in the summer.
Yeah, so
from last conversations. That's just a quick question, just to know where you're coming from now.
Yeah, so thank you. So recently we actually just got our CQIP protection granted from the DOH just a couple of weeks ago, so at the end of January. So we haven't been able to accept any applications thus far because we didn't have that CQIP protection, but now that we do, we currently are able to accept applications. So from thus far, we haven't received any yet, but I'm hoping that we'll receive some soon.
Yeah, and just so you know, a number of us commissioners did go to the offices and review the files in your office, just to assure ourselves about what was being done. The other issue, sort of as a comment, and one of the things is that one of the big goals of this was to be able to take these lessons that have been learned to to have a broader audience to them, just to an institution or to a small group in an institution. And it met with resistance on the part of the risk managers at institutions to be able to take the cases. You can de-identify the case. You can even change a lot of aspects to it, but still get the essential components. And I think one of the goals that many of us on the commission have is we'd like to have we're talking about using these sort of cases of ones that we've had that have been settled, and to show that and orient it to a patient safety point of view. It would be an important part of this to be able to do that as well. Has the climate for risk managers changed? As far as I imagine, you've been doing a lot of reach out to these folks, since starting in the summer. Has it changed, or are still risk managers at major centers still paranoid about having lessons learned distributed to improve safety on a broader level than an institution?
No, yeah. So of course that is one of the things that we are hoping to accomplish with our CRP certification and CRP screening. So when we initially started like brainstorming about what CRP screening would look like, because again, this is going to be a new process outside of CRP certification. So with screening, we're really hoping that this would be an opportunity for folks to feel a bit more comfortable to talk about the cases that they're experiencing at their organization. And we at the foundation still have that goal of being able to distribute lessons learned from everything that we're receiving in a, of course, as you said, de-identified manner, so that the findings and the learnings that are happening at each organization aren't siloed to that specific department or even that specific organization, but can benefit the healthcare community as a whole. So in terms of risk managers' reactions to this, I believe it still is kind of like an uphill battle. However, there are some that are very interested in really pushing this work. For example, some of the folks on our review panel, our risk managers are very passionate about CRP. So for some, it can be very widely embraced. For others, it may take a little bit more encouraging. However, I'm hopeful that we'll get there.
Thanks.
And yeah, thank you for mentioning that comment, Sandy. As I just mentioned, we have been able to have our programs, both CRP screening and CRP certification, CQIP protected. So we have that in place now.
But while you're waiting for others, I thought I'd just ask another question.
Of course.
Aren't there a number of states that are doing this successfully? That's sort of what I had thought. And if so,
Yeah,
how many
absolutely.
and where?
So off the top of my head, I know that California has been doing this. With California, their CRP certification is actually operated with Beta Health, which is like their insurer. So they're in California, they have a bit more incentive for hospitals and other healthcare organizations to submit their cases to Beta Health, since that could impact the insurance aspect of CRP and of these interactions. So I know that they've been having a lot of great success there. I also believe this is happening in Michigan as well. However, I don't know as much about that program as I do about Beta Health. But it is happening. Washington isn't the only place where CRP certification is happening. And we're, again, with what's happening with like CMS and what's happening with the PAC Collaborative, more and more folks across the country are gaining interest in CRP, and hopefully will be implementing their own CRP like screening or certification processes in time.
I apologize. I had some technical difficulties, but looks like you guys made it through. Dr. Curry, go ahead, and if you want to ask your question, feel free, or Felicidad, I'm sure you can read her comment.
I'm going to take a second to read it. All right, so do they feel that CRP is redundant? So with the CRP process map that I showed at the beginning, I'm sure that a lot of you folks, when you're looking at it, could like recognize that a lot of the steps that are taking place in CRP actually can be incorporated or are already incorporated in like current healthcare systematic responses to adverse events. What makes CRP a bit different is the level of conversations and interactions that happen between patients and families, as well as making sure that really we're emphasizing the peer support that providers receive after an adverse event happens. And of course, it depends on the organization, on how far along they are in having their CRP process implemented. I know some organizations, as you said, they're doing this. They may not formally call it a CRP, but essentially what they're doing is CRP. However, for other organizations, maybe smaller organizations, organizations out in more rural areas, they may need a bit more like guidance and support in terms of what responding to adverse events could look like. So if CRP, so in terms of your question, CRP really is a complement, is how I would put it. It should be able to easily flow into the system. And really, it's just checking the boxes to make sure that the communication is happening with the patient. The patient isn't feeling abandoned after after a harm event happens, as well as making sure that it's in place for one of those like maybe proactive offer of a financial or non-financial settlement if that's applicable to the event that took place. So I believe that it could actually like easily flow into it could easily flow into hospital processes. And then another aspect was that the feedback that the review panel provides really is it's valuable, and it can really support in terms of how it can be better improved in the future. So that's, yeah, in a nutshell, that's what we're doing, and that's how I believe that our two CRP services can help support. Let me know if you'd like a further explanation on things. Okay, thank you. All right, I'm going to read your comments, Sandy. Yeah, absolutely. So again, that is another one of the uphill battles that we're challenging, that we're faced with. So with our two CRP services, we actually work very closely with Dr. Tom Gallagher at the University of Washington, and he really was the one who started CRP certification here in Washington in the first place. He is currently involved in the PAC Collaborative, which I showed you before, and then he is also the executive director or something like that for the Collaborative of Accountability, which is another CRP support program that's here in Washington. And through conversations with him, what we've been hearing is that, sometimes it could be challenging for hospitals or organizations to even pass out flyers or anything like that, or have something have a informational pamphlet about CRP within the organization. So it's an uphill battle, that's for sure. But I think through persistence and through further providing evidence that this works, this is helping, I think that'd be a great support in the long run to seeing if this could be implemented in more places. And then I'm reading your comment, Kyle. Okay, yeah. So can you talk briefly about how the CRP certification process interacts with patients and their families? What if the patient/patient's family will not engage? Yeah, so with our CRP certification, again, what that actually looks like is we have the application. It's available on our website. It's a lot more detailed and in-depth in comparison to the CRP screening application. And that's primarily because, as I said before, for CRP certification, we're really looking for the fine details to make sure that all of the elements of CRP, were currently present in the final response. Because again, with CRP certification, folks can only apply for that at the very end of their CRP. So everything has to have been completed before seeking CRP certification, if that makes sense. So once everything is said and done, they'll go through our CRP certification application. It's a pretty lengthy document. It could take a little bit of time. But then after that has been submitted to us, the CRP team, which mostly me, again, that's de-identified and then given to the review panel. They'll have time to read through it. Also, there is the opportunity for folks to submit supporting documents if that's requested. And supporting documents could look like excerpts of the medical record pertaining to the event or evidence of communications that's been happening between the provider organization and the patient, that kind of stuff. So all that information would be taken, de-identified, and submitted to the review panel. We'll look through it, review it, and either certify the event if everything checks out, I guess. So with patients and families in the past, what we did was we had a survey that we requested for folks going through the CRP certification process to hand out to see if, hey, were you satisfied with the CRP, or were you satisfied with the level of communication that was happening? How did you feel about XYZ as pertaining to the event? However, when we did have that survey in place in the first run of CRP certification, we found that not that many institutions actually pass that out to patients because as you think about it, the patient has just experienced a harm event, which could have meant that the patient died, and the family is now receiving a survey to request additional information or about like how the CRP event went for them. So as we are thinking about how we're going to implement CRP certification again for this round, admittedly, we still have a lot to think through to make sure that the patient and family engagement is actually what's the right word? Well, to make sure that we're not making them uncomfortable in any way, and that it would actually be a valuable experience for those who would like to be involved. So that is something that we are still trying to think through, as well as making sure that it's in line with the CQIP protections. But of course, that is something that is on the top of our minds. So thank you.
So I have a question for you. I know we're still a little bit in our infancy of this program, but do you have any insight or foresight as to how data is collected and analyzed to assess the impact of CRPs and possibly identify areas for improvement?
Yeah, absolutely. So for all of the research studies that have been published in academic literature thus far on CRPs and CRP certification. What their method of data collection was, again, was those surveys that I was just talking about. So that was one of the ways in which they collected data on like the effectiveness of CRPs, and also use that as opportunities to identify areas for improvement. However, again, like I just mentioned, we are still looking for ways that could be a bit more meaningful and more respect. Maybe that's not the right word, but at least a process that would make folks feel a bit more willing to participate in, because after experiencing something so difficult, it can be really challenging to then be faced with a survey. So that is something we're still thinking through. However, the information that we collect through CRP screening and CRP certification is, still at the end of the day, a form of data. And I think that it can actually pair very, very well with what's currently being supported, or at least that's currently being put out through the DOH. So, the DOH does their adverse event reporting quarterly and annually, where they show the number of adverse events that are happening at organizations, as well as the type of event that happened at the organization. And what we can do with what we're collecting and the information that we're hoping to push out widely from what we're learning with CRP is those lessons that were learned, so that we can add a bit more substance to seeing like, hey, yeah, like this adverse event happened, but here's what actually happened, or here's what the response to that was. Here's how we implemented things to make sure that that wouldn't happen again, and how the system can be improved, or how provider practice can be improved. So with that, with what we're doing with CRP screening and CRP certification, we're really, again, opening that door to add more substance, to also like better inform the healthcare community as a whole through lessons learned. So yeah.
I just had a comment because I do know
Mhm.
the individuals involved in this. There was originally a ARC grant to try to reduce medical malpractice costs. And so Tom at the UW got a grant. I know I have a colleague from the University of Illinois who did as well, who was head of quality improvement at that hospital. And there was another institution, I can't recall where it was. The communication and resolution process was largely initially started in order to reduce malpractice costs by improving patient safety, and by both communicating with the family about the changes that have been made, that this would never happen again. And I know at Illinois, they had a lot of patients who even had a relative die in the hospital, who actually helped really support this policy, because they really thought that it involved them. It gave some closure to having a death of a loved one or some serious injury, and they made a change in the hospital setting. So that thing, and the malpractice costs in Chicago are extremely high. And with coming in with that resolution thing, coming in with the institution, then these, again, large institutions offering some kind of package, cut out a lot of these attorneys from doing malpractice claims. And in the process, everyone felt better, right? It reduced costs, they made safety improvements in the hospital, and the families felt better. Now, I don't know, that's just, again, I've heard quite a bit about it in the old days, and there were some stories that were pretty remarkable. But again, it's probably not a huge number of cases.
No, yeah, absolutely. Kind of like what Karen was touching on. There has been a lot of research and evidence showing exactly what she just said, that when a patient, after like harm has happened, again, what they mostly want is an explanation of what happened, and an apology. And again, that can go that can go a really long way in terms of the reconciliation that happens following an adverse event. And what she just said, with CRP and implementing that and actually using this process and having that transparent and empathetic communication throughout the entire thing has shown to reduce the amount of lawsuits or malpractice claims that have been happening in terms of adverse events, because they're feeling that they're heard and that they're feeling that they're being listened to, and then they feel like still respected and they still can feel trust in their healthcare. So it's very interesting. It's a very interesting topic and world of CRP to be in. I can gladly share a variety of resources that are available if folks are interested in reading more about this.
So I have a question about just thinking ahead and possibly next steps as we kind of wrap up here. Just from kind of a how do we help the provider aspect, how can we help effectively train or support our practitioners in these communication skills and navigating the CRP process? What does that look like from your point of view?
Absolutely. So again, that really would be looking at like, hey, if they are looking for additional support in navigating those difficult conversations and actually making sure that the CRP is going, it's following the code of CRP principles. That's how we can help with the CRP review panel, especially through CRP screening. Again, that happens in real time. If any questions or about conversations that happen or any challenges or barriers that are coming up during the current CRP response, that is a perfect opportunity to get some support from our CRP review panel. Again, these are folks who are very passionate about CRP, and some of our review panels actually went through the CRP certification process in the past, so they have experience in navigating this kind of stuff. So they would be a great resource to turn to if you're looking for that additional support in how to actually approach this conversation, how to overcome this barrier, et cetera, et cetera. But outside of what we're doing with CRP certification and CRP screening, I know I've mentioned the PAC Collaborative a lot of times, but they are also a very excellent resource for folks to use. Again, it's a year-long commitment. However, they will like really work with you hand in hand to start that CRP from the ground up at the institutional level, so that folks can like have an institutional champion to help lead that on the ground CRP work. And through that, that's where you can really have more staff, more providers informed of the tools and resources of what exactly a CRP is, what practicing CRP principles look like, which can really help provide that practice that they need in order to actually fulfill those really difficult aspects of CRP. So those are two options for y'all. Come to us with the CRP screening. Again, we are 100% free, as well as check out the PAC Collaborative as well. They do amazing work.
So thank you. Are there any other questions or comments that folks would like to share before we close out here?
If there is no other questions, there is one other thing I would like to say. If you're interested in actually like hearing about what the CRP process was, I'm holding a webinar next month. You can find information about it on our website. qualityhealth.org/CRP. In that, I'll talk more about, again, what we're doing with CRP certification and screening, but I have one of our review panel members. Her name is Claire Hagan, and she was the former risk manager at Providence Health, and she'll be talking about her experience with CRP. She'll be going through her experience going through CRP certification, and it'll be a really great experience to hear more about what this actually looks like. So if you're interested, please check out our website.
Thank you. And I'll get those resources from Ms. Smith, and I'll put those on our website where you can view this recording, or other recordings, and find out more information about these CRP programs that we're offering. So thank you again for presenting this valuable information. It's been super informative, and I really appreciate you being here with us today. Did an amazing job. Thank you so much. Virtual round of applause.
Thank you so much for having me. Also, if anyone has any other questions or would like to hear more, feel free to reach out to me. I'm welcome to talking more about this. So thank you so much.
Thank you. And thank you, everyone, for attending and participating. Have a wonderful week, and remember to take care of yourselves. Take care, everyone.
Bye. Thank you.